Hello, good afternoon, and thank you for joining this seminar on crisis management, marketing and communications. Right, I shall share my screen with you and then we can start the presentation. So just a bit of housekeeping before we start. If you have any questions, please type them in the chat box, which is here on the YouTube Live. And also I will take questions at the end in comments or give you my email address if you'd rather talk offline. So I am Veronica Montgomery and I am the Clinic and Patient Liaison Consultant here at the Fertility Hub. And since the start of the COVID-19 crisis, I've been writing regular blogs on crisis management, marketing and communications. And then every 4 blogs, I put that into a 40-minute seminar just to give you the highlights. So this presentation will cover my background and that of the Fertility Hub. Today we're going to look at best practice on your website, how IT can enhance your marketing efforts, strategies that we need to adopt in these new challenging times, and the impact of COVID on media buying and planning. So my background is that I started my career at the Royal College of Nursing, where I was the advertising manager across 8 of their nursing titles. I then moved to the other side of the fence where I became a media buyer, and I was director at Kingsway Advertising, where we specialised in healthcare marketing for the NHS. And then I was a marketing consultant over on the Caribbean island of Barbados, and I worked with the Barbados Fertility Centre for 15 years. And then last year, 2009, I founded the Fertility Hub. So the Fertility Hub is a publishing platform that brings patients and healthcare providers in assisted reproduction together under one umbrella. On the patient side of the site, we've seen a huge upsurge in traffic over the pandemic, and our average now is about 40,000 visitors a month. And then from the main site, there is a doorway through to the back room, which is locked access for healthcare professionals only. And we have over 5,000 healthcare providers registered to use that section of the site. And as I say, the site went live in March 2019. So we're now in our 2nd year. So in the seminars that I've done so far, part 1 covered the actual crisis itself of COVID-19, how marketing and communications fits into that crisis, the financial implications, which as we're already seeing are quite dire, and the use of PR. Then the 2nd seminar covered how to protect your brand during COVID, online marketing, using online seminars to build trust, and the power of newsletters. And the last seminar we did looked at video marketing tips, the use of podcasts, cost-effective marketing, because money is the name of the game right now, and digital marketing. So jumping straight into today's presentation, we're going to, Right, annoyingly, I've got my Zoom control bar in the way. There we go. I've got it out of the way now. So today we're going to start off with best practice on your website, and that's not to say it's best practice on your website. That was not the right slide. So essentially, your website is your shop window to the world, and we'll talk a bit about how your global market has become a local one. But still, what's on your website is where everybody goes to check you out. So your website must show that you empathise with the current situation. Patients are very relieved that services have now resumed and they can resume their fertility treatment, but fear and anxiety remains. And fear and anxiety is something, unfortunately, that goes hand in hand with infertility diagnosis. Add to that a global pandemic, and everybody's feeling very vulnerable. Then the icing on the cake was having their treatments suspended. So the mental health of patients is very vulnerable, and you need to empathise with that. Your website needs to be very transparent, because transparency builds trust, and patients really need somebody they can rely on right now. So do have a dedicated COVID page that is accessible from your homepage and every other page on your site. So anything your patient is getting information on, if a query pops into their head, well, what about that because of COVID? They can just click on your frequently asked questions on your COVID page. And then also, I'd just like to sort of cover what your COVID page should include. So let's have a look at that now. So I've just done a screen grab here of RMA New Jersey, who are one of our healthcare partners. And this is taken, so you can access this from their homepage. And this gives their COVID-19 updates. So within your COVID page, you want to have your operational changes, where telehealth is now replacing face-to-face, where your nursing staff are working from home, where conversations will be taking place from home instead of in the office. And also PPE for staff and patients. They very much need reassurance. You need to make sure they feel comfortable that your unit is COVID secure. And also, if treatment is successful, are you advising patients to shield once they're pregnant? What is the local government advice in your country? Have that when people arrive, do they have to go into quarantine? Or will they have to quarantine when they get back to their own home country? So all of these are big decision factors on whether or not to travel to your unit for treatment. Also the air travel restrictions, again, here in the UK, we have quite a long list. People are jumping on and off it. Which country? There's a big scramble to get home before you have to quarantine for 14 days. So yes, we have like Spain, France, Portugal, Greece. All of those places now, unfortunately, have gone on to our unsafe list. So, things like that you need to be aware of where you're targeting patients. And also, if you're offering COVID testing as part of their treatment, what sort of COVID test? Will it be a swab test? Will it be an antibody test? What are you offering them, and how much will you be charging for it? So all of these things that patients are going to have questions over. Also, as I said, we've all been affected by the COVID pandemic, whether that be, actual illness or losing people through the illness. But just in our personal lives and our business lives, everything has changed, and everybody has been impacted by that. So it's no good sort of like, call us today for treatment. Things have got to be a lot softer. So change that hard call to action to a soft call to action. Do share the latest news on COVID and pregnancy. It's something patients are very worried about. Obviously, we have the governing bodies all keeping a very close eye on that. And so far, touch wood, we haven't seen any adverse outcomes for pregnancy or newborns. You also may feel you're rather sick of COVID by now. I know I am. But unfortunately, it's not getting better. It's going back to how it was. We're seeing more restrictions implemented here in the UK again. And, depending on where you're attracting patients from, things could be quite bad in their area. So we are sick of it. We all want it to go away, but it's not. So therefore, do keep making your videos and your blogs and talking about it, because, everybody's at a different stage. We're about 3 weeks behind Europe. They're starting to see their second spike. We're starting to see a rise in infections again now. So do just bear in mind where you're targeting patients and what's going on in your country. And COVID is still very much at the forefront of everybody's mind. That said, if you're outbound messaging, if you are going to send COVID emails, make sure it is relevant. It's about your operational changes. Do keep your website updated with those operational changes, and also keep updating Google My Business. So again, is your receptionist in? Is she working from home? Can she put you through to people? Make sure your opening hours are correct, because if a patient goes to the effort to pick up the phone and make the phone call to you, they don't want to be hit with an answer phone. So just make sure your operational hours are updated on Google My Business. And then in the last section of this, I want to talk about the importance of the little s, and that is your site secure? And do you have HTTPS when you log onto your website? If not, you must get a security certificate, which then gives you the HTTPS address. I mean, you have to look at it from a patient's point of view. Would you be putting in your name and your medical history and all of your personal information on a site that wasn't secure? The same if you're taking payments via your website. If I get a big warning that says this site isn't secure, there's no way I'm putting in my credit card details. So that little s is the difference between a patient making an inquiry to your clinic or leaving as soon as they get to their website because they've been scared off by the fact that your site isn't secure. So S is for secure, and that's how you want to make your patients feel. Okay, so sorry, this is the final slide, best practice on your website. So make contact easy for patients. You know, it's terrifying to have to pick up the phone and talk about your personal problems and your husband's sperm count. It's a very personal subject, as you know. So, you know, have your contact email address on every page of your website. It's so important. A lot of clinics still don't have that, you know, especially American clinics. They just want patients to pick up the phone, and patients just won't do it. You know, they will contact a clinic outside of the States who they can email. So make it easy for your patients, have an email on there so they can hide behind their computer. Also, monitor the changing behaviour on your website. It has changed, again, depending on where you're targeting patients. A lot of people are still working from home, so therefore mobile usage has switched to desktop because people can look at any time of the day. They don't have their boss looking over their shoulder anymore. Also set up events in your Google Analytics for government announcements, both your government and the country where you're targeting patients. Update your quarantine rules so patients know how much time they're going to need off work if they come to you for treatment. And then finally, whilst, you know, usage is changing constantly, some people are returning to the office, but mobile usage is still about 75%. So it's important that your site is mobile friendly. So always check your website on a mobile device as well. Okay, moving into the next section, how IT can enhance your marketing efforts. So, you know, realistically, can you see the full picture of a patient journey from their first inquiry right through to them holding their baby in their arms? Very few clinics can. So I'm just going to give you a sort of ideal scenario, and then I'm going to give you some options of how that can happen. So in an ideal world, it would be fantastic if the marketing team knew exactly which of their marketing channels was delivering those patients to the clinic. Now, there are many ways in which we do this as marketeers, but it involves an awful lot of data collation, which I'll come on to in a minute. So what if you could follow them right from their very first inquiry, and you knew how you got them there to that first inquiry through to the commitment of treatment? And then imagine being able to track where they are throughout their stage of treatment with you, right through to them becoming pregnant and actually knowing when the baby was due, as a marketeer being able to follow up with them for testimonials, and being so organised that you could send them a new arrival gift when the baby comes along and you've had the good news that the delivery went well. So in reality, very few clinics can actually follow that patient all the way through their patient journey. We might know through our Google Analytics which other websites we advertise on and how traffic is arriving on our site. But essentially, we'd have to get the nurses to ask how you heard of us with every patient they speak to, and have the full drop down of all the campaigns that are currently running. This then involves a collation of a lot of data as the marketing team when you're putting together the marketing budget for next year. And you're going to have a marketing database, which is going to be where people have signed up to your newsletter and where you're collecting data of new patient inquiries. Then when they actually speak to the nursing team and the medical team, the doctors, they go into the patient database. Then when they move through their treatment cycle and they go into the laboratory, they move into the lab system. And then the admin side also needs them in the accounting system. So you've got all these different systems that aren't talking to each other. So what we need to do is integrate that data flow. And what this does is it's seamless then for staff and patients to understand how all this data talks to each other, how these systems talk to each other, and where each patient is at. So a CRM system would be the glue that holds all of those systems together and that they can talk to each other. This can also, the CRM can also highlight to all team members the milestones on that patient journey. So the egg retrieval day, transfer day, pregnancy test day, and due date. And the strongest tool in the marketing toolbox is word of mouth. So for the marketing department to have an ongoing relationship with that patient and get them to spread the word of mouth in all the forums that they discuss their fertility treatment and their pregnancy with, if the marketing team are on top of that, that's got to enhance and saves you so much work of actually advertising spend and marketing spend if the patients are doing the selling for you. So what we have to do is ensure that we are capturing that data, and then the CRM can allocate tasks to each of the team members along the patient journey. As I said, marketing have many channels of how they're reaching out to the wider net of patients, and then capturing how that patient arrived at your clinic is vital to know what is successful and what is failing. This also is really good for going back on historical data. We know that patients can take on average 2 years to make a decision from their first inquiry to a clinic to actually committing to a cycle. So if we know that patient numbers are going to be low in a few months' time, the system would alert us to that before it's even happened. And it's also really important to capture this data from offline campaigns, because again, Google Analytics will only tell us what came to our website. It won't tell us whether the radio campaign or the TV campaign or the magazine article has had any impact. There'll be a general feeling in the clinic that the phones are busier or the inquiries are heavier. But it's important to actually capture that data and allocate where it came from. And as I said, rather than being reactive to all patient numbers are low in a few months' time, at the moment we're dealing with a backlog of all the patient cycles that were cancelled. But as I say, because it takes 2 years for a patient to actually make that decision, there's going to be a gap. And also clinics, have been focused on reopening safely and getting all the cycles that had to be cancelled rescheduled in. Nobody's looking 6 months down the line of what the cycle numbers. So again, a CRM would alert you on those cycle numbers, and you set a threshold and set that key performance indicator to tell you that cycle numbers mustn't go below 100 per month or 50 per month. And then when that does, then marketing can go full steam ahead on the gas pedal. So it's kick-starting action, and we're going to be proactive rather than reactive. Also, what a CRM can do is measure your staff productivity. So IVF clinics are quite unique businesses because the medical team are actually the sales team. And so the CRM could tell you, for example, if you have 2 nurses who handle 50 new patient inquiries a day, the CRM tells you that Jane speaks to 30, but Susan only speaks to 20. But then what you see is that Susan actually gets 80% conversion rate, and Jane only gets 20. So this tells you that even though Susan speaks to less new patients, she spends more time with them and she gets the patients on side. So then that's a human resource element of redefining job descriptions, and rather than, put a bit more pressure on Jane of not to whiz through her to-do list for today and spend a little bit more time, actually, Jane is quite productive in all other areas. She's very efficient. So maybe Susan should handle the new patient inquiries. And as I said about those key performance indicators, from the dashboard of your CRM, you can set up these goals of what you want the business to achieve. So you can set, we must speak to this many patient inquiries per day. We want to reach this many cycle numbers. And also the CRM can integrate with voice over internet calling. So an incoming call can be integrated. The system recognises this phone number and will bring up the patient record and give you the full history of your previous conversations. Also the same with outbound, it can flag up patients that you haven't spoke to for 6 months who you need to check back in with. So you can allocate tasks to members of the team, and the system will tell you who those people have got to contact. So as I said, don't rely solely on Google Analytics. This is only going to monitor your web traffic, not your entire marketing plan. So the CRM can capture those offline campaigns too. And also, as I said, if you can integrate those incoming and outbound calls, then that's a very streamlined process for both the staff receiving the call, that they don't have to go over the same procedure and ask the same questions they asked in the last call, all of that information is there on the database for them to see. And really, working in the dark is no longer an option. You know, we need to be accountable for every penny we're spending, both on staff costs and our marketing spend. So as we adapt to this new normal and living and working with COVID, we must be accountable for every penny that's spent. Okay, moving on to the next part of the seminar, I just want to talk about strategy. And in any crisis, marketing takes the centre stage because they are the ones in charge of communications and your messaging. And so those communications have to be solid and convey the message of the clinic to the patients. And as I said previously, you know, we need to be reactive rather than proactive. The nature of COVID-19 evolving meant, you know, we were all caught on the back foot. We were all having to be reactive. And, you know, now we know, you know, the worst case scenario that we all got completely shut down. Now we can sort of make a strategy and plan for that. And our strategy is going to be proactive going forward. So really, as uncomfortable as it is, you have to think the unthinkable and plan for it, because we didn't have that forewarning previously earlier on in the year. So you want to make 3 plans, and they are: plan for the best case scenario, the middle of the road, and the worst case scenario. And it's crucial that operations and marketing work hand in hand as to how to implement this. So all managers need to get together, socially distance, and rewrite the business plan from scratch. So first off, your business plan has got to empathise with the patient frustration and patient fear. And I'm not saying that we want to prey on that patient fear, we want to alleviate it, but we must be very aware of it and empathise with it. So operations have gone through endless changes, you know, the procedures, the COVID securing the unit, the poor operations department really have had their work cut out for them over the last few months. And those changes then have to be relayed by the marketing department so that the patients feel safe and secure at your unit. Finance have also had a horrendous few months with the headache of keeping the operational costs down whilst implementing all these new operational procedures and trying to attract revenue to keep the money coming in a much tougher market than we were in January. HR have also had a pretty tough time because they've had some tough decisions to make on reallocating roles, redefining job descriptions, and sadly also having to make redundancies. So if life was a bed of roses, and in our best case scenario, if we plan for this, and that is we dare to dream of a COVID-free world, we have a vaccine, or the virus is under control. But even in our best case scenario, the damage is already done. And now our business plan needs to focus on recovery. And there's also grave concern over how patients are going to fund treatment in a global recession. So your budgets and your targets very much need to err on the side of caution, even if life was a bed of roses. You need to identify areas of growth, and maybe that is something like, you know, only targeting patients with insurance. But again, with job losses, you know, the insurance might be related to, might not be private, it might be through their employer. So yeah, you have to identify those areas of growth and then go after them. And also the countries in which you're going to target patients. You know, if your global market has become a local one, how much more can you get out of your local market? Bearing in mind infertility affects 1 in 6 patients worldwide, so what couples worldwide. So, you know, there is still mileage to be had in your local market, but it does depend on the economy. So middle of the road scenario, and that is realistically, we accept that this is our new normal, and you know that this is it. This is how we go forward for the foreseeable future. Where we're at now is where we're going to stay. You know, in targeting patients, flight restrictions can change overnight of which countries can and can't fly into your country, and where patients can and can't travel to and from. So you need to be monitoring those countries and, you know, where you're targeting patients, and update your COVID pages with this information. If we stay where we are now, we're going to be faced with local lockdowns, you know, and if that continues, again, you know, you ever have to keep juggling balls and changing your marketing strategy to reflect where you were targeting patients. But having a plan is better than having no plan at all. Okay, and the worst case scenario, which we don't want to even think about, but we have to force ourselves, is that we experience the second spike globally, which is starting to happen across Europe. If the clinics are ordered to close down again, how do you plan to manage the patients for another devastating blow, having to tell them again that their treatment was suspended? And how can your clinic actually sustain another loss of revenue? You know, if you did have to close again for another few months, you know, if you had to close between now and Christmas, would you still have a clinic left with your overheads and no income stream? So all of this sort of worst case planning, whilst it's uncomfortable to think about, we have to think about it. Nobody wants to repeat this, but look back and see if there's anything we could have done better, lessons we could have learned. Have we learned lessons from it? And what would we do, you know, if we face that same situation again? And also, it's a good time to get all of your departments to list their strengths and weaknesses of how well they felt they coped with the lockdown of shutting down the clinic, how well they felt equipped. You know, I had a lot of people tell me that the nurses, you know, the ones having to take all the stick from the patients, didn't feel very supported by their superiors in having to relay that bad news. And, you know, and it's devastating for the nurse who's emotionally invested in this patient as much as it was for the patient. So again, now's a good time to sit down, look at all of these procedures and say, could we have done it better? And I'm also saying, you know, listen to every member of staff, because you never know who's going to come up with a genius idea that might just save your clinic in these very uncertain times. Okay, so sorry, I just did that one, didn't I? And then finally, just making sure, yeah, is the listen. And as I just said, listen to your staff. So listen to all of your colleagues. They've all got valuable feedback on their strengths and weaknesses, which must be put in the new business plan. Most importantly, listen to patient feedback of how they felt they were treated by your clinic. Again, you know, during we had National Infertility Awareness Week, we did our own patient survey of how they felt with treatment being suspended, and literally 69% felt that they weren't supported by their clinic. They just felt they were left high and dry. You know, the clinic closed up shop. There was no further communication until the clinic reopened again. So again, you know, all of this thing, listen to that patient feedback and base your operational policy on that feedback. A lot of clinics also furloughed their marketing department. So who was going to get the message out to the clinics if your marketing department were on furlough? So, you know, you need to think about all these things of what would you do differently. Base your communication strategy on that feedback, and also base your financial forecast on that feedback. Because, you know, you can pluck any figure you like out the air, but how are we going to make it happen? That's, you know, the important thing. And teamwork has never been so important. You know, everybody has to get on and everybody needs to work together to save the clinic. Okay, the last section, which hopefully is slightly cheerier than having to do strategy and crisis management, is about impact on your media strategy. What impact has COVID had? So you need to adapt your media buying and your media planning to reflect this crisis. So first off, identify the opportunities of where you can reach patients and get on board with those. Don't go dark on your patients. As I just said, you know, no communication is just leaving the patients out there on their own. And, you know, that's not what we want to portray. You know, we do want to be there to hold their hand throughout this crisis. A lot of research has shown how much the shutdown of clinics affected patients' mental health. And what you need to be doing in your messaging is highlighting those support services. And don't freeze your marketing altogether, because, as I say, now you might be dealing with a backlog, but what's going to happen 6 months down the line? Also, if we did face another shutdown, you know, you need the clinics who did well were the ones who kept up their presence, and they're the ones that said we had hundreds and hundreds of inquiries during lockdown because the clinics were closed. and patients came to us to ask which clinics were open. So clinics that did well were the ones who continued to speak to patients throughout the lockdown. And a sad fact is that costs are going to increase because of all the operational changes, and revenue is going to decrease because you can see less patients, and it's going to be a lot harder to get patients to commit when they're unsure about jobs and income. So because of this, globally, the media has taken a beating, getting a good old kick up the ass. And mainstream media has reported huge financial losses for Q1, 2 and 3. Specialist publications have been hit particularly hard. So my take-home message from this is there are deals to be had. So definitely, look at new markets, look at new audiences, and get onto those publications and, say what you can afford to spend and negotiate off their rate card, because nobody's charging their rate card. And, as a publisher, I would say I'd rather somebody picked up the phone and offered me some money than looked at our rate card and went, no, we can't afford it at the moment. So yeah, we're all, as publishers, we are all up for negotiation at the moment. The patients are still out there. You've just got to change the way you reach them, because people's buying habits have changed, their viewing habits have changed, their readership habits have changed. This whole not commuting to the office has meant newspaper sales, the newsstands are still full at the end of the day. People aren't out shopping so much, so they're not picking up a daily newspaper or buying magazines. But online has seen a huge 70% increase. So you definitely need to get digital now. If you weren't already, you need to get on it. And embracing online is the only cuddle you can safely have these days. So the days of giving somebody a hug, the only embrace you're going to get is with online media. So, you've got your website, but you need to drive traffic to that website through other online channels. Other ways to get traffic on your website and to have a visual virtual presence is to do virtual events. Also, the use of podcasts, which I spoke about. We're doing part of the Parenthood Patient Seminar series, which are well attended. Also, we're doing a podcast series, which talks with experts. All of these things, IVF patients are very information hungry. So the more content you can put out online, and think of it like a spider's web, the web is really about your name being captured in many, many different places. And the patient keeps finding it and going, I've heard that name before. I've heard good things about them. I'm going to now visit their website. Also, with digital adverts, they're mainly done on an auction system. Markets are in decline. So therefore, the price of the auction is going to be a lot cheaper and you're going to get a lot more for your marketing budget. And don't just resume your marketing. Don't, everything you push pause on, don't just push play again, because there's so much wastage. I mean, I'm here in London, I Google IVF, I see clinics advertising in countries we're not allowed to travel to, or countries where we would be put in quarantine when we come home. That is wastage at the moment. I'm not saying, stop those campaigns altogether, but not at the level of spend you were spending pre-COVID. So it's very important you review all of your online strategy for media buying. And also, your global market has become a local one. So do investigate local radio, local TV. Again, there are deals to be had. Maybe you haven't looked at your local radio station before, your local TV station. They are also desperate for income because lots of companies have gone completely. So there's no marketing coming from them. And other companies, just are freezing at the moment. So, they're not marketing. So again, just, pick up the phone, build a relationship and have that conversation and offer what you can afford to pay. And then my final slide is about don't confuse publishers with facilitators. There is what I call a terrible disease in the infertility market, and that is the facilitators crop up every couple of years, some new ones crop up and then they disappear. Now, I'm sure there are facilitators out there who you have great working relationships with and who do indeed deliver you patients. And, the role of a facilitator is to hold the patient's hand throughout their journey. As I've said, patients take 2 years to make a decision. Our business is publishing, and a publisher invests in your market. You know, we specialize in assisted reproduction. We spend our marketing budget on reaching infertility patients to bring them to our site, to read the information we have for patients, and to market our site to you as healthcare professionals. And then we have a whole section of the site dedicated to managing an IVF unit, research updates, clinical papers, reader offers, supplier updates. So all of these things is what we spend our time doing, is getting that information together and sharing it with you as an industry and with the patients. So don't expect advertising to be free, because nobody can operate with no income. You know, our business is the same as your business. Fundamentally, a business has outgoings and a business has income. So don't expect your advertising to be free, and don't expect that we are going to work as a facilitator. Our job is a publishing platform. We will attract the patients, and then we will send those, you know, if you're advertising on our site, you will then benefit from those patients who come to our site. But we, you know, our small team of a web developer, a designer, an editor, and me handling the commercial aspects, I don't have time to hold a patient's hand for 2 years through their fertility journey. They can make inquiries to the site. We will refer them on to the healthcare professionals. By all means, as I said, drive a hard bargain. We are more than willing to negotiate. We would rather have you on the site than not. But, you know, that facilitator's journey is to hold the patient's hand, and they have the time and obviously the investment to keep them going until they're paid their 15 or 20% of the patient cycle. We don't. We're completely different. You know, and it is our role to keep you abreast of all the industry news and research, and provide the patients with unbiased information. You know, and the way I look at it is, if you only got paid when you got a patient pregnant, then you'd be closing down your clinic very quickly. And the same to us applies as a publisher. You know, if I had to wait 2 years for a patient, that we attracted the patient, we put them on to you, and then we waited 2 years for them to sign up for treatment and then get paid, we wouldn't survive 2 years. So just don't confuse the two. Facilitators have their role. However, you know, I've never ever had a patient through a facilitator. And you know, publishing is so different. So just please don't ask for it to be free, or that we will get paid commission when the patient decides to sign up for treatment. You know, we work the same as a radio station or a news station, that you pay to advertise, and, you know, you reach our audience. My final slide is just as I've ended all of the seminars throughout this crisis. During lockdown, I worked very hard in researching all of the antibody tests on the market, which were hard to find a price point that was acceptable for clinics to buy, and an entry level, because a lot of places wanted sort of 30,000 tests, which wouldn't really work for an IVF clinic. So I found this one, on-site rapid test, and was very happy with the sensitivity, and also it can be used in the clinic. It's a very low entry level to buy into it. You only have to buy 7 boxes, which is like 210 tests. So it's in situ, so it's an antibody test, and diagnosed individuals who are suspected to have had COVID. Obviously, we still, you know, this is an ongoing pandemic. This is a virus that we still are learning about. So what we don't know is if having COVID gives you antibodies, if those antibodies give you immunity, and how long that lasts for. Now we're seeing different strains coming out, that you may have had one type of COVID, but you haven't had another. So it's entirely up to you as clinicians as to what you do with that information. If a patient has had antibodies, we are awaiting new guidance from the British Fertility Society on COVID testing, which test to use, how to test, when to test. So we'll be publishing those as soon as they come out. It's a very simple finger prick test. So then the results are available in 10 to 15 minutes. But in these uncertain times, you know, personally, if I was running a clinic, I would be offering this to my entire local community, because people want to know. And this is a revenue stream for you to be charging for antibody testing in your local community. whilst, you know, we're uncertain as to how we're going to move forward with patients in the current climate. So whilst people have still got money and want to know, I would definitely be offering this antibody test. And then the main thing is don't overcharge. There's been some very bad press about clinics charging £500 for a swab test that people in the UK could have got on the NHS. So be realistic. You know, it's a very low entry point. It's a very cheap test. So you don't need to overcharge for it, and you can make it affordable for patients who are already spending thousands on their IVF treatment. Thank you very much for listening. If you have any questions, I will stay online for the next 15 minutes. I will answer the ones in chat, but once I end the broadcast, the chat will disappear. So please write any questions in comments, or if you need to leave or don't wish to comment, then please feel free to email me. It is Veronica@the Fertility Hub. And I urge you all to stay safe. And I know we've heard it time and time again, but we are seeing a resurgence. So please do look after yourself, wash those hands, don't touch your face, and stay your 2 meters or 1 meter apart. Basically, just stay apart. Anyway, take care, everybody, and I'll see you again soon. Thank you.